Maraming salamat, Ms. Yas Moralia, sa segment na Naturally Yours. With us this morning, Dr. Fresco, Yapedon, talking about HIV and AIDS. We talk about HIV being a virus that you can get through sexual contact, unprotected anal sexual contact, ang most common mode of transmission. Also from bodily fluids, especially blood. Pag pinabayaan over the next years, pwedeng humina ang immune system and you get infections and that's how you die. Doc, there are other modes of transmission. Meron bang maternal to child transmission,
Yes,
HIV?
mayroon. No? That's why it is recommended now that we advise our pregnant mothers to undergo HIV screening. And they can actually take the antiretroviral even during pregnancy. And if you discovered it late in the pregnancy, you can also give antiretroviral to the baby.
Okay.
So you can prevent now the infection of the baby from the mother.
Gaano siya, Doc, ka-effective?
Well, based on the study, almost 100% ang effective.
I think in Africa, ang dami talagang HIV cases dun. And one of the main modes of transmission talaga yung mother to child.
Mother to
No?
child.
Okay. But at least it's preventable. That's why
Preventable.
recommendation ngayon, magpa-screen na rin yung mga nanay. We've had patients coming into our hospitals na getting these pneumonias at a young age, 20 plus pa lang. Dapat ba talaga yung mga doctors mag-suspect ng HIV na sa mga young patients getting?
Siyempre, evaluate mo rin yung ano, kasi yung iba na-offend no? Pero of course, with proper explanation. No? Ako, ang nagiging problema ko, kadalasan may kasama ang pasyente. So I cannot discuss it openly to them. No?
As the parents might be there, no?
Parents, yung ano, of course, these young people will not admit in front of their friends or parents na meron silang mga ganong sexual experience na high risk. No? Hindi yan amin. Pero of course, yung mga infection na ganyan, on and off sinusitis, pharyngitis, on and off na pigsa, these are possible HIV cases. So, yung mga herpes zoster in the young, and in fact, yung balakubak nga, di ba? Seborrheic dermatitis can be a manifestation of stage 2 HIV.
Ulitin natin, Doc, ha? Yung may mga seborrhea, yung may mga rhinitis.
Yung on and off na rhinitis, pneumonia, pigsa.
May mga sores.
Mga fungal infection ng kuko.
Ayan.
These are early signs of HIV.
So, dapat hindi natin kinakatakutan ito kasi mas mahusay na itong nalalaman natin kesa sa huli na yung lahat.
In short, no, parang very low, very weak yung immune system, kaya pabalik-balik na infection. So, yun. So, kung kayo yung tipong may kakilala kayo na parang lagi na lang may sakit. So, I guess that is
and even tuberculosis now is a common secondary infection with HIV. And kaya targeted itong mga TB patient to have HIV screening.
How can we prevent HIV?
Well, be good.
Be good and stay good.
And probably, if we cannot abstain, if we cannot prevent ourselves to indulge with sexual act, then we have to be protected. So, condom has been shown to protect against HIV and other STD for about 94-95% of the time. So, yun lang. But of course, the best is abstinence, single partner, and ano pa?
Any form of sexual contact, you can get HIV.
You can get it from oral sex, no? Lalo na kung yung lalaki ang mayroon.
Okay.
Hindi ko walang sugat yung bibig, hindi nakakahawa. Yung virus can penetrate an intact mucosa. So even in the vagina, even in the anal area. No? Sa lalaki, yung vaginal secretion of course can also have HIV. So cunnilingus can transmit HIV. So yun yung mga...
Last week, we talked about vaccines kasi, no? Wala pa bang vaccine for HIV?
Wala pa. Kasi very versatile itong HIV. It mutates. So, nag-mutate siya. Mabilis ang mutation rate.
Marami forms yata.
Gawa mo yung isa, meron naman bago. So, can you...
Let's just hope in the future na magkaroon. So, ang Ebola may experiment na ngayon. So, HIV sana meron.
Sana meron. Kasi intracellular ang virus, no? It lives inside the cells. That's why it's so hard to target these viruses.
That's true. Kahit na may antibody ka against it, basta nakapasok na sa cells, it is difficult. And itong HIV has a parang hindi siya nagtatago siya dun sa cell. Even yung what we call markers in the infected cells, yung mga HLA na ma-detect nung body na infected ka. Minsan hindi nagmamanifest yung antigen on the surface.
Last one lang. You talked about antiretroviral agents in the treatment of HIV-AIDS. Ano ba yung mga side effects nitong mga agents na to?
Actually, napakarami naman.
Marami.
Napakarami ng antiretroviral. No? So, it's very difficult to discuss it. Pero yung mga common, itong mga AZT, lamivudine, tenofovir, itong nevirapine, efavirenz. Marami siyang itong efavirenz, itong nevirapine, hindi pwede sa may liver problem.
Hepatic.
Efavirenz naman, meron siyang parang psychic effect, no? Sa mental side effect. No? So, some of them have liver side effects. No? Pero, compared with the previous medication, antiretroviral, it's safer now to take the antiretroviral.
And the benefit is still higher than
yes, of course.
the potential for side effects.
And also,